So this is the lecture on antivirals, antimalarials, and antihelminthics. So antivirals are just that, antivirus. Antimalarials are just that, they're anti-malaria, and antihelminthics are anti-worm. So viruses we're all very familiar with. Oftentimes the method of transmission is coughing, sneezing. They replicate themselves, sometimes utilizing your own body to do so. Common viral infections include the flu, herpes, and viral hepatitis. General signs and symptoms often include headache, fever, cough, nausea, vomiting, diarrhea, fatigue, and muscular pain. So the flu is highly contagious, affects the nose, throat, and lungs. It's seasonal, more prevalent from fall to spring, and there are 3 antigen types, A, B, and C. The herpes virus comes in 5 varieties: the simplex 1, simplex 2, varicella zoster, which is also known as chickenpox or shingles, the Epstein-Barr virus, and the cytomegalovirus. Hepatitis B is a serious liver infection. We all get immunized to it as nurses. Transmission can be via a needle stick or intimate sexual contact or childbirth. HPV is found in all body fluids, including blood, semen, and vaginal fluid. Signs and symptoms of HBV include anorexia, vomiting, diarrhea, jaundice, malaise, and myalgia. So myalgia or pain. Malaise is being tired. Jaundice is being yellow. And anorexia is actually decreased appetite. So vaccines can be given, like we have talked about earlier. The flu vaccine is made with eggs. So if someone's allergic to eggs, there are alternatives. So healthy children have 65 to 90% success rates. Older adults, vaccines are effective 60% of the time, but less than 60% if they're older and have multiple health problems. Diagnostic tests for influenza. Influenza A has the direct flu A. Both influenza A and B can be done with that quick influenza test, which is a nasal swab that goes down nasopharyngally and can be sent to the lab. And just as everything else, it can be done with a longer test too, but we often use the quick view tests. Antiviral non-HIV drugs. We can have imatidine or Simitrel, cytofovir, or foscavir, or adivovir, or entecavir. Many of these have the word virus almost completely in them by putting VIR somewhere in them. Imatidine does not, though. Acyclovir, famvir, gangcyclovir, ribavirin, valcyclovir, and valganciclovir. These are all antivirals also. The one you are probably most familiar with is Tamiflu or oseltamivir. And that one, if given early, when someone has the flu, it can decrease the symptoms and the duration. But, we get into that longer than 48 hours into the disease, and it's really not going to do much good. Antimalarials are different from antiviruses in that they treat malaria. So this is a protozoan disease, so it's not viral, it's not bacterial, it's protozoan. The incubation period is 10 to 35 days. So there are protozoan parasites that fall under this category. So when we see symptoms, there are fever, chills, and sweating, and flu-like symptoms. Drugs to treat this include things like chloroquine or hydroxychloroquine, so Aralen or Plaquenil. Those are the most common ones. So these are combination drugs, so we use usually more than one when there's active malaria, and then usually one if it's prophylactic. So side effects of Plaquenil include GI distress, mood or mental changes, blurred vision, and blood dyscrasias. The quinines can have a lot of side effects, including GI distress, vision changes, dizziness, confusion, delirium, seizures. Sometimes there's nerve involvement and tinnitus, renal impairment, blood dyscrasias, cardiovascular collapse, and decreased respirations. Those don't sound very fun, do they? So the antimalarials, when we have a patient who's on antimalarials, we want to monitor kidney and liver functions. And then we also want to tell them to take the drug with meals to prevent GI distress, report any vision changes, avoid alcohol. This is usually with every drug, right? So advise individuals traveling to endemic countries to take the drug prophylactically. Now, antihelminthics are different than all the rest of the meds that we've talked about because antihelminthics are work against worms. So there are different types of worms: tapeworms, flukes, roundworms, and tissue roundworms. So biothianol or Bitin or Hetrazan or Stromectol or Pin-X, you can imagine what kind of worm that's for. These are the antihelminthics. They're usually given for 1 to 3 days. They usually have side effects that include GI upset, dizziness, drowsiness, headache, and weakness. Nursing interventions, we want to give these after meals to prevent GI distress, encourage good hygiene, warn against driving motor vehicles, and when they get off of this medication, in some cultures, provide education and availability of shoes.